Hello students, we will discuss an interesting case in the oral cavity that little different from the traditional thing, but of course we had a lot of discussions in earlier brief lectures about the oral lesions. Just see this one. What is this lesion? See that? See here in the palate, in the hard palate. Look at that proliferative lesion with velvety appearance like this, with the irregularity over the surface, velvety appearance, very typical in the palate. Look at that. It still could be benign or it will be locally malignant, like what is this? I'll just inform you. See this typical, very proper. Look at this, very typical lesion in the palate. So it could be papilloma of the palate or carcinoma of the palate also. We can't say verrucous carcinoma. Verrucous carcinoma is the carcinoma which is exophytic, dry, velvety look, and usually does not go through the basement membrane. So lymphatic spread and blood spread is not there. Only locally malignant, like marginal ulcer. And so wide local excision cures the condition. It's quite common in the oral cavity. Can occur in other mucosal areas also. So that is called verrucous carcinoma. It's very commonly seen in oral cavity. And other areas may occur sometimes in the genital area or in the perianal region also. And you can always also think of minor salivary gland tumor in this area, because the palate is one of the common sites for minor salivary gland. So you have to think of that. But usually they will have a swelling, and over the summit ulceration occurs. It's a very solid swelling, sessile one. That is a typical clinical look of the minor salivary gland. But still you have to think of, because it's a common site, minor salivary gland tumor. So all those things I have told: velvety look, everted edge, minor salivary present with the often ulceration over the summit. Already told, it's a very typical look. Solid sessile mass with the ulceration over the summit is a typical, rather a diagnostic of clinical at least, of minor salivary gland tumor. So usually it is non-mobile. That palate is very hard structure. There is a mucoperiosteum under that. Mucosa is adherent to the periosteum of the palate bone, the hard palate. And so any mucosal lesions will get adherent to the periosteum very easily. So it is uncommon to get mobility like in other mucosal areas. So usually they are non-mobile. Of course, features are depending on what condition patient is having. If it is verrucous carcinoma, it may be firm. If it is squamous carcinoma, it will be indurated. And if it is a minor salivary gland tumor, it will be firm. Like that, consistency may vary depending on the clinical situation or clinical pathological type which you think of. It will eventually erode in the palate and goes into the nasal cavity and may cause a pathological oronasal fistula across the palate. And it is a midline, so it causes commonly, it is very close to the midline here also. It may cross the midline very commonly, again like in the tongue, floor of the mouth, in the palate. When it's close to the midline, it may cross the midline. So lymphatics both sides can get involved, because drainage crosses lymphatic drainage. So both sides of neck you have to examine 1A, 1B, 2, 3, 4, 5, both sides. So examination of both side neck lymph nodes for significant involvement by the pathology is important. But in verrucous, lymph node will not get involved. Squamous cell carcinoma, it will get involved. But examining the patient is very, very important. Both sides is important. I already told why it is so. And so management is wedge biopsy, ultrasound neck for lymph node, then CCT, head and neck region with a very clear idea. So if you want to see the palatal extension, may have to do MRI. Then treatment is once you confirm wide local extension, and you can do some flap and reconstruct the area. Mucopalatal flap is rotated and place it there. You can always call the plastic surgeon or reconstructive surgeon to do that. Cervical lymph node dissection if lymph nodes are involved, which is confirmed by either ultrasound neck simply or by CCT head and neck region. If it is so, you have to do MRND one side or other side. If it's doing both sides, retain always IGV at least one side. That is important. Pre-operative, post-operative adjuvant chemotherapy based on the stage and grading of the disease, which I am not going to discuss, because stage, grade, everything decides what you are going to give post-operatively. Chemotherapy, radiotherapy, what is the dose, what type, everything. Usually it is decided by the oncologist. So remember, palatal carcinoma is not uncommon. So many differential diagnoses you have to think of. and it's not mobile, unlike in other mucosal lesions like oral cavity, in the buccal mucosa, floor of the mouth, tongue, or lip. They are mobile until they get infiltrated into the deeper structures, where it is not so here. It's always fixed to the because of the mucoperiosteum nature. And so you can always go through my manual of surgery, oral cavity chapter. All these are given in detail. And same thing, clinical aspects and surgical anatomy, they given in my clinical methods in surgery with video. And also you can go through that and answer the MCQ. Commonest site of carcinoma among paranasal sinuses are frontal sinus, maxillary sinus, ethmoidal sinus, sphenoid sinus. Students, please put the right answer in the comment box. I acknowledge and appreciate your answer. I'll put the right answer later period. So host triangle is formed by all this A, B, C, D. So what is host triangle? That find out, and boundaries of the host triangle, put it in the right comment box, and I'll give the answer at a later period. So student, I acknowledge your answers. Please write the right answer. Please go through this one sequence, write the right answer. The quotation of the day is, words once spoken and hearts once broken are the hardest thing to repair. That's the dialogue. So whatever you said, that you cannot reverse it. It's like it's a vocal documentation. Same thing. Once your heart is broken for some reason with somebody, it's very difficult to repair. That's exactly meaning of this quotation. I hope you enjoyed this quotation. So students, please go through my SRB's manual of surgery. It gives a detail about all CBMA syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise. General surgery, gastroenterology surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered, instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also, everything covered with the quotations, with the illustrations, with the photos, everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery, and face exam, face MCQs, everything for both UGs and postgraduates. Also go through my clinical methods in surgery with the video of how to examine in each topic. It gives a detailed examination method, but of course there is no management in this. It's a clinical book, and briefly in a tabular form, differential diagnosis and good photos and exactly how to examine and how to write case sheet of each different purpose, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and OPSI and practical exam. So very, very useful. That would have all videos of the examination. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different officers, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my digging out lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year so that you will have the clear idea. You can wear the exam, have the clear idea, academic part, everything. Will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and face the exam. So students, I hope you have understood this lecture very well. Thank you so much.